the hip dip deficiency here, and that forms as you've got the space here, and no amount of exercise or gym will help it. It just is a deficiency that's genetic, and some people like to correct it, other people may leave it, but it does cause a nice effect when you just softly round it and you can see it. The trochanter comes around here and you can see where that gap is around there, and that's why we're going to fill in this section. Hip dips are an anatomical deficiency that happen to the side of the hips, just below the trochanter. So you have a dip in where the bone falls away and there's less muscle. So you have this deficiency. It's genetic. It's not like a lack of training or bad diet or anything like that. It's just a genetic abnormality. And some people have it deeper, some people have less. Some people are bothered by it, some people are not. It's pretty relaxed. But what we can do now is we can use filler, and it's a specially made body filler that can be used to just soften or slightly round where the hip dip is, to give what many people feel is a more pleasing kind of figure around there. Hip dip fillers can last up to 2 years, so the filler is quite a stiff filler that does last. Some people like to top it up at 18 months, some people wait 3 years to have it again, but in general it will last about 2 years. Okay. So hip dips are safe. Obviously it's a procedure. It involves needles pierced in the skin, so you can get infection, bruising, bleeding. But in general, it's very safe. It's a very safe area. The filler's made to integrate in the skin and the area that is slightly lacking. And so it takes around about 40 minutes to do, and it's very safe. What you can tend to get is a downtime, and I'd say the downtime's anywhere from a week to 2 weeks. And what I mean by that is you'll be in work the next day, although a little bit sore. But the downtime comes with, there's probably a bit of bruising for a week, but also the filler needs to integrate over 2 weeks. I use a crosshatch technique when I do hip dips. I put filler this way, adding volume, and then I put filler this way, adding volume. So there's 2 threads. Sometimes I do a 3rd thread. Minimal on this side. It was minimal to moderate on this side, but it was a complicated one because it was bigger than the actual size of the cannula, so we had to spread what we're doing. But as we can look here on the side, to get to the side here, you can see now that that is now rounded through there, and so it looks great. The aftercare is very simple. You'll rest for the day of the procedure afterwards. Don't be looking to do anything strenuous. I'd prefer if you didn't exercise, especially your lower body, for at least a week. Some people love taking HYACorp tablets and HYACorp cream on the locality of the area. You don't want to be doing anything that's going to pressure it, or any kind of jacuzzi or very, very hot baths.